So the increase in healthcare can really be broken up across 5 different factors, which we explored in this paper. The first is just more people and increasing population size. The second is people getting older. We know that older people tend to spend more on healthcare. As the population gets older, we see the society spends more. The third reason is just about disease prevalence or incidence, how present a disease is in the country. And then the fourth and the fifth reasons relate to the health system. So the fourth is about going to the doctor more or using healthcare services more prescriptions, more visits to the hospital, the emergency department. And the fifth is about the prices or the intensity of care once you're within the hospital system or when you're in an outpatient center. The intensity and the price are hard to distinguish for us using the data that we have. The idea is that intensity talks about what's happening at a doctor's appointment or in an inpatient setting. You can imagine that over time, the intensity of care has changed, meaning we've substituted out some technologies for newer, maybe more fancy, and in some cases more expensive technologies. So diagnostics have gotten better, they've replaced old diagnostics, but in some cases they've gotten more expensive. As that changes, we see that we spend more on healthcare. So what we see is that there's a lot of variation in what is driving the increases. And in some cases, it's increases in prices and intensity. In other cases, it's the other factors that are actually driving the increases in healthcare spending. So an example would be in outpatient care, we see that there's a major increase, about an 85% increase in spending between 1996 and 2013. But most of that spending increase actually has nothing to do with prices, and it's more increases because of more use. So more utilization per prevalent case, or another way to say it is more trips to the doctor per sick person. So it really is a very diverse story where we see across different diseases and different types of care, we see different factors driving the increase in healthcare spending. Yeah, so that's a great observation and something we studied in depth in this paper. What we see for inpatient healthcare spending is that there has been a replacement with the amount of days spent with the amount of spending per day. So to put that another way is that for the average admission for many diseases, the amount of days spent in an inpatient care has gone down. We're getting better at helping people get out of the hospital faster. And there's lots of reasons for that, including incentives put forward and constraints put forward by payers. But what we found is that while people are in the hospital for fewer days, they spend more per day. And that leads to a net increase in spending in inpatient care. Pharmaceuticals is really interesting. In the United States in 2013, we spend about $300 billion on retail pharmaceuticals. That means those are pharmaceuticals that you buy at a pharmacy as a patient. And that's a major increase, over 150% increase between 1996 spending. And what we've seen is that spending is driven actually by lots of different things. So for the case of diabetes, it's been mostly an increase in the price and the type of drugs that people are using. But for other diseases, we see that we spend more on pharmaceuticals actually because people are using the pharmaceuticals more often. An example of that is spending related especially to hyperlipidemia or high cholesterol. What this paper highlights is the ability to focus on each different disease. So again, we take diabetes, we see the differences in what's driving diabetes spending versus low back and neck pain. And allows us to have a more focused understanding of why we spend more and allows policymakers to think about how different policies could limit growth for specific diseases or specific types of care. As a researcher, I'm particularly interested in to continue to dive deeper and try to understand the nuances of these data. One particular addition is to start to disaggregate the spending increases due to prices versus the intensity of care, and making sure we can understand the differences that relate to price versus, say, something like just changes in technology is really important. Also taking the data further and going through 2015, 2016, so that we have more contemporaneous, more current results that we can analyze is tremendously important. And continuing to assess more and more diseases.